To diagnose acute lymphoblastic leukemia, we first look at the blood count and the blood smear. Sometimes you may find these the blast cells, that is, we call it the cancerous cells in leukemia are called blast cells. We may identify them from the blood itself. If we do that, then we are able to do specific tests on the blood itself. But if we don't see the cancerous cells in the blood, we then have to do a bone marrow test, with which you stick in a needle into the iliac bone and draw bone marrow aspiration from there, and we do tests on these cells. So primarily we look at it under the microscope, and we are often able to identify that these are cancerous cells. To know exactly which type of cancer it is, we perform a test called flow cytometry. This test will identify exactly whether it is a lymphoblastic leukemia or a myeloid leukemia or any other type. And then we have the diagnosis firmly established. Once we have established the diagnosis of acute lymphoblastic leukemia, we also have to do various genetic tests on those tumor cells, right? So you may have 10 patients of acute lymphoblastic leukemia, but each of them may have a different outcome, and that is related to the different genetic mutations that have happened in these tumor cells. So we have to identify these mutations. Some of these mutations are favorable, they respond well to chemotherapy. Some are unfavorable. So if these unfavorable mutations are there, we may have to go in for more advanced treatments, including bone marrow transplant or some of the recent immunotherapies that are now available for ALL. So importance of risk stratification is that it can completely change the outcome of treatment.